Watch this.
I don't understand why these lives don't matter anymore.
A frustrating battle for the Ada County Coroner's Office. Just like healthcare workers, they too are under heavy pressure from the surge in COVID. We're already seeing the major consequences of crisis standards of care in the state of Idaho. Just ask the state's Director of Health and Welfare. Interfaith Sanctuary continues to do their best to battle COVID inside their shelter, but times are tough. And by tough, we mean the worst it's been since the beginning of the pandemic. It's not a secret, COVID has created more challenges than we can keep track of at this point, some big, some small, but things in Idaho continue to trend the wrong way, and fast. It highlights problems we hoped our community would never face. But here's one for you, and I'm going to say this one bluntly. In Idaho's most populated county, we are overloading the county coroner with too many who've passed because of COVID. And last year, the Ada County Coroner's Office brought in a refrigerated truck to handle the expanded caseload brought on by COVID deaths. The coroner's office ran out of space then. Today, 18 months into this pandemic, that space is needed again, plus some. Between two separate trucks, the Ada County Coroner's Office has room for about 90 extra bodies when their facility space runs out. And running out of space is an everyday battle these days. Things are on such a bad trajectory. At this point, it begs the question, what happens when space runs out again?
We are actually very overwhelmed. Our entire office staff, facility, everything that we're doing, we are operating at capacity.
The surge in Idaho COVID cases is creating major issues for crucial community services.
But it's burnout.
Just ask Ada County Coroner Dottie Owens. She says the heavy COVID caseload her office is dealing with comes with major consequences.
We're 6 months down on pathology reports, which is very, very hard. It holds families up for insurance benefits. It's every single aspect, from administration to forensics to my investigations team. We are operating at capacity.
Last year, the Ada County Coroner's Office was forced to purchase a refrigerated truck to keep up with COVID deaths. Owen says they need that extra space now more than ever.
Our normal cooler is full, and our mass fat trailer has 5 decedents in there.
When I speak with frontline healthcare workers, they describe a similar scenario where they're doing everything they can, but they're simply overloaded. How would you compare your situation to what frontline healthcare workers are going through?
You know, we're dealing with the exact same thing. We really are. And between our facility challenges, our staffing challenges, you know, we're just really operating at capacity on all levels. And what we're doing is we're nursing it through. We're doing everything we can to nurse it through.
Where do you go from here? And I guess just you keep pushing through. I guess, how do you keep doing this? And I keep asking this to frontline healthcare workers as well.
You know, you do. You show up because we're here for our families. We're here to make sure that we try to keep our community safe. We show up, we do the job, we go home, and we do it all over tomorrow. We were discussing this internally this morning, and everybody is just, you know, the comments of, we're just exhausted. Why don't people believe this? Why don't they believe in this at this point? It is so frustrating. When we're doing death notifications and we're on scene with these grieving families and we're hearing from spouses, why didn't we believe this? Why didn't we do something with this up front? What do you say? We're desperate.
And it sounds like you get some pushback when you talk about COVID deaths.
I get a lot of pushback. I get told that we're, you know, making money off of COVID. I get told we're fear mongering. I am telling you, at the end of the day, we're the ones that are laying eyes on these deceased individuals. We're the ones dealing with the grieving families. There's no financial benefit for county when we're dealing with this.
There's no benefit to the coroner's office at all.
There's no benefit to us at all, because on top of it, what people forget is that not only are we doing the COVID and we're monitoring the pandemic piece, but we're also dealing with the suicides and the homicides and the children deaths. And, you know, we handle all of that. There's no benefit at all for any of us.
I can hear it in your voice, the emotion and the passion, but I'll ask, when people are pushing back and you're seeing this day in and day out, and you're staff, you're seeing this day in and day out, I mean, what are your thoughts when someone just so flippantly says, no, this isn't real, it's a hoax?
It's really hard for me, to be honest with you, Joe. Emotionally, it's hard for me because we see these families firsthand. We see these healthcare workers. We're talking to the hospitals, funeral homes. It just, there's no end to it. And I don't understand why people don't believe in this at this point. I have no words. My staff is so frustrated. They're frustrated and they're exhausted.
Owen says earlier this summer, the situation actually looked pretty good as COVID deaths steadily decreased in our community. But that all changed in recent weeks.
For a while, we were only seeing one or two a week. And then it gradually increased to two a day. And now we're getting multiple that are reported to us daily. Yeah. We're seeing that on the tail end. I believe we're over 60 on the month that we've laid eyes on for just September. You know, for me, honestly, there's a lot of frustration. There really is. There's a lot of frustration. There's a lot of grief. I don't understand why these lives don't matter anymore. I don't get it. I don't understand why we aren't taking this serious. Why are we not shutting this down? It's a lot of frustration. And I hear that every single day when I walk into this office. We say anything, anyone in this office says anything about it, and we're fear mongering. We're lying. I don't understand that. Why don't the numbers speak for themselves for this? I just don't understand that.
Owen says recently their smaller mobile trailer was dispatched to help cover issues in another county. She knows that trailer is likely to see activation again soon.
At any moment, a region can get into trouble and we'd have to haul that up there for them, or a hospital here or somebody. So we've got both trailers in our parking lot right now and we're going to hang on to them.
Is there fear that those trailers may not be enough?
Sure. We know what our bed capacity is for morgue space in the county, and we are monitoring that every single week.
Some important context I want to lay out after that story. The Ada County Coroner's Office is handling deaths that happen in Ada County, but that includes people who were taken to an Ada County hospital from outside the county. So think about it. We have several major hospitals that people come to in Ada County from well outside our area. Now, Owens tells me that one example that she can think of recently, a patient was life-flighted from Montana. They ended up passing away from COVID. Now, that death isn't reflected in Idaho or Ada County numbers, but regardless, the Ada County Coroner's Office still has to handle it, and it's in their records. So they're dealing with a lot more than the state or county numbers could ever indicate. And let's talk about data. We got a fresh set of numbers today from the Ada County Coroner's Office that indicates exactly what they're dealing with. We told you the personal aspect. Let's talk about some data. And we narrowed it down to a few major takeaways. Now, since the pandemic began early last year, there's been 799 deaths that have been reported from the Ada County Coroner's Office. Again, not all those deaths were from Ada County residents, but the deaths happened in Ada County, and those bodies were brought to Dottie Owens and the Ada County Coroner's Office. We're going to show you some graphs here. You can see that December 2020 was a very difficult month. There was 152 deaths there in Ada County that the Coroner's Office dealt with, and that averages out to about 4.9 deaths per day. But this month, it's looking like we could actually break that record. We're going to take a look at this year through yesterday, September 20th, 96 deaths. And that's about 4.8 deaths per day with another week and a half to go in the month. We are on track to match December at least. And the average age of those dying continues to go down. At the start of the pandemic, back in March of 2020, the average age of those who died from COVID was just over 76 years old. And you can see how it breaks down from there on your screen, all in the mid to late 70s in 2020. But this year specifically, this summer, that average has dropped. It is now to its lowest, to 62 years old in July. So far this month, we've seen 10 people die from COVID who were under the age of 50. Compare that from January to August of this year, where we had 12 die who were under the age of 50 in total. Again, this is only for deaths reported from the Ada County Coroner's Office. We've got a breakdown of this data on our website right now, ktvb.com.
A few words now on what we're seeing with the patients that is significantly different from the December surge. They're younger. The age range of our adult patients today is 20 years to 85 years with a 2-week running average of 58 years. That's down from 72 years in the December surge.
It's what the state's largest hospital system, St. Luke's Health, is currently seeing inside their hospitals statewide. That includes places like Boise, Meridian, McCall, Elmore County, Twin Falls, and the Wood River Valleys. It's not just Ada County we're talking about here. This is statewide. Now, Idaho has been operating under crisis standards of care as a state for 5 days now. a few days longer for those in North Idaho. And today it got personal for a prominent member of the Department of Health and Welfare team just hours after crisis standards of care were implemented. I want you to listen now to Health and Welfare Director Dave Jepson's story.
My mom had a stroke Thursday morning, just a few hours after crisis standards of care was activated statewide. Not only was it stressful that my mom had a stroke, there was added worry about the availability of healthcare when she went to the ER. Things were different in the ER. There were other patients receiving care in the waiting room. My mom fell when she had her stroke, and there was a concern that she had broken bones. The x-rays were done in a non-traditional x-ray area with a longer wait than usual. Normally, a person in her condition would be held overnight for observation. Because of crisis standards of care, after she was stable, she was discharged later the same day from the ER. My family and I took over monitoring her at home, and she is recovering well. The ER team at St. Luke's was amazing. Despite the large patient load, they were caring, empathetic, and positive.
If you need care, please go to the hospital. You will not be turned away, but the type of care you get, it may be different, as you heard Director Jepson say, and you may have to wait longer to get it, but at this point, you will get it. Well, COVID cases, as we know, are surging throughout the entire state of Idaho, and the Delta variant does not discriminate. Interfaith Sanctuary, which provides housing for those without a home, is responding to the worst COVID surge they've seen since the pandemic began. It comes at a time where their resources are being stretched thin. Here's our Katya Stepovic.
At the beginning of the pandemic, Interfaith Sanctuary partnered with the city of Boise to establish a designated COVID-positive hotel to send all positive guests for quarantine, with some funding from FEMA to cover the costs. This time around, resources are being stretched thin, and the hotel is filling up.
I mean, it's completely different from when we were first doing the COVID hotel with COVID-19. Because if they were moving into the hotel, they were pretty stable.
Jody Peterson-Steigers, executive director at Interfaith Sanctuary, says this time around there are more cases of COVID-19, and this time people are more sick.
The guests that are coming now who are unvaccinated, they might be fine for 5 days and then they take a tremendous dip.
Which is forcing staff to take on a role they aren't familiar with.
Our staff is like being trained how to measure oxygen levels and keep track of guests. It's very, very stressful because the variant behaves different.
In 1 week, 27 guests tested positive for COVID and were sent to the shelter's COVID positive hotel with only 42 rooms available. So far, Peterson-Steigers has had 3 guests in the hospital and 1 who was not fully vaccinated pass away from the virus.
I was at the hotel yesterday to check on a guest, and he went from sitting up and eating to not being able to get a breath. He was very red. It happened probably in 2 hours' time. The fire department and paramedics showed up very quickly and were able to get him to the hospital. I don't even know how he's doing. He was really sick. It's just scary.
Not only are people in the shelter getting very ill, but there's not enough staff to look over them, and only 15 spots left in the COVID positive hotel.
We thought 42 was going to be plenty because we never, ever had more than 12 during the first part of the pandemic when we were running the COVID hotel. 12 was our outbreak.
While the shelter plans to bring in a nurse to help from Boise State, Peterson-Steigers worries that the bigger surge is ahead and that their rooms could fill up.
This is a lot of trauma. We are definitely willing to step up and do this again because someone has to. But it's very scary. We are not trained to do this. We're learning as quickly as we can, but the responsibility is daunting.
Katya joins us now, and Katya, I have to ask. I know that we're hoping it doesn't get to this point, but what happens if all 42 rooms at the COVID hotel are filled up?
Well, everyone hopes it doesn't get to that point, but unfortunately the reality is COVID cases are surging and it is a concern. And the reason why they're hopeful though is because a lot of patients and guests are allowed to leave after 10 days of quarantining. But if they were to get full, Jody says they would just have to double up each room and add another bed in every single room, totaling 84 beds, which also isn't ideal because like we said earlier, they don't have the staff to even look over what they're dealing dealing with right now. So again, it's just this vicious cycle that comes down to what we've been saying this entire time. People need to get vaccinated. I mean, they're seeing a 72% vaccination rate, which could be a lot higher.
Yeah, and call it what it is. I mean, the Interfaith Sanctuary is not systematically set up to deal with something like this. They're set up to help people experiencing homelessness, but they're not set up to set up a hotel for people trying to deal with the pandemic.
Right. Like you said, staff members are learning, like I said, staff members are learning to read oxygen levels. Like, imagine that. That's crazy.
Well, Katya, I know we're going to stay on top of this to see what happens as we keep an eye on the capacity at that hotel. Guess who's back? Back again. 10 Idaho lawmakers heading to the State House tomorrow to talk about making Idaho's longest legislative session maybe even longer. That and vaccine mandates. And guess what? You can get in on the conversation. We'll tell you how. But no need to wait until tomorrow to tell us how you feel. Text us right now with your questions. 208-321-5614. Make sure to include your name and the hashtag the 208. We're going to share a few at the end of the show. But first, more thank you messages sent to us, addressed to our healthcare workers. Well, the State House is usually a ghost town this time of year, unless you're one of the children that rings the bell in front of the building. It's very loud. But it will be an unusually busy day tomorrow as 10 lawmakers are going to head back to debate bringing back the entire legislature. Those lawmakers, 8 Republicans, 2 Democrats, they're part of the Interim Committee on Federalism, which considers state sovereignty issues. And tomorrow, they will specifically focus on a number of topics related to vaccines and the vaccine mandates. That, of course, includes President Biden's recent vaccine mandate, which says that companies with more than 100 employees will be required to get the COVID vaccine for their employees or have them get tested weekly. It also includes requiring all executive branch employees, as well as hospital and long-term care facility employees, to get vaccinated. Now, some Republicans have voiced their concerns with these mandates, saying that it's not the federal government's job, rather the state's job, to decide on these matters. A group of Republicans tried to force a quorum last week, but only 12 of the 36 needed ended up showing up. Now, the committee will need to agree on specific pieces of legislation that they want to debate before they can call back the legislature. There's going to be public testimony on this. It'll be taken tomorrow from 10 o'clock to noon and then again from 2:30 to 5. You do need to sign up in advance to testify, and I can tell you from experience, these things do fill up quickly. Now, this comes as Idaho's hospitals continue to operate under crisis standards of care because of the pandemic. A majority of those who are hospitalized are unvaccinated. Now, healthcare workers can now ration care in order to save as many lives as possible. Right now, just over 51% of Idahoans ages 12 and over are considered fully vaccinated. The national vaccination average hovers around 64%, making Idaho one of the lowest vaccinated states in the country.
It is a beautiful Tuesday. Look at the blue skies this afternoon. Now, you might notice a few smoke in the higher levels for tomorrow. We're going to flip this flow again to the south. Temperatures by the weekend could get up somewhere into the mid-80s. But for today, look at this. We had temperatures in the 70s with clear skies. Couldn't be much better. Futurecast is just showing that there are some high clouds. This is getting through tomorrow. There's tomorrow afternoon, getting into the evening. There's even some isolated showers, just so that you know. But it doesn't look like it's much of a deal as far as later in the evening. I think the biggest thing about it will be some breezy conditions. So tomorrow's high temperatures will be, you can see they're up about another 4 or 5 degrees, up around 80, 81 degrees, somewhere along through there. So your 7-day forecast, 80 degrees for tomorrow, low tonight down to 52, which is still a little bit of a chill in the air. If you notice Thursday, 48 for the low, 49 for Friday. Those will be the two coolest days as we look at the 7-day forecast. However, as we get into next Wednesday and Thursday, there could be a shower and the temperatures could actually drop to about 45 degrees for lows at night. So daytime highs, well, we're back to a 76 degree reading for Thursday and Friday 78. As those high clouds move through, the storm is to our north. It'll help bring in a little cooler air, and I think what little smoke that we'll be seeing, that will help that out as well. And then as you continue in this 7-day forecast, you'll see Saturday with 83 degrees, Sunday, which is up to 83, and Monday 84, Tuesday with 79 degrees. You know, fall begins tomorrow at 1:20 tomorrow afternoon. So as you can see, the temperatures have come down from some of our summer months, but still we're looking at some 70s and some 80s through this next week.
All right, let's close the show with some of your questions, comments, thoughts. This one, please tell me what to do when I'm allergic to the vaccines. I can tell you on a personal level, I am allergic to some vaccines. I reached out to my doctor, told me the COVID vaccine I was good with. So the best advice I could give you, reach out to your doctor and have a personal conversation about the vaccines. This person says, thank you so much for the last responders and all the coroner's office has to deal with on a daily basis. We appreciate everything you do. That's from Julie. Thank you for sharing that, Julie. Still with us here, we have a thank you all the healthcare workers for dealing with this day after day after day. May God bless you all. Agreed there. Thank you to all of our frontline healthcare workers. This person says, good to see you, Joe, but I got to know, where is your sidekick, Brian? I dared Brian to count to 1 million, and it's taking a little longer than I thought. So, I don't know, try it at home.